Good afternoon, Ken. How are you?
Good, thank you.
Good. My name is Dawn Davis, and I will be doing the musculoskeletal assessment and the neurological assessment on Ken today. He's agreed to allow us to video him, so I thank you for that. We have shut the door for privacy, washed our hands, and we have our clinic dog here with us assessing as well.
That's cool.
So, as we get going today, we're going to be moving in a lot of different positions, so if there's any discomfort or concern, please let me know and stop me during the process, okay? First thing we want to do is assess his shoulders and look, so I'm going to have you sit up for me and make sure everything looks nice and symmetrical, and it does. I'm going to go ahead and kind of palpate the structures here, go across the clavicle, around to the shoulders. Feel any pain or tenderness with that?
No.
I don't feel any swelling or anything at all. I'm going to move your arm around just a little bit. Thank you. I'm not feeling any crepitus or anything with the movement. Okay, good deal. So the first thing that I want you to do is put your arms down to your side and go ahead and lift them up over your head. Good. And then bring them back down and back as far back as you can for hyperextension. So we have flexion and hyperextension. Okay, good. No problems with that. And then this time I want you to take your arms out to your side, away from your body. That's abduction. And then bring them back down, and that is adduction. Okay, good. No problems with that at all. I want you to lift your arm like you're going to flex it up again. Keep your arm straight against me. Good. Go ahead and pull back down. And then let's go ahead and check this side. Okay, and then back down. Perfect. Okay, and if you don't mind to stand for me real quick and have your back to the camera, I want you to put your arms behind your back, palms out, one over the other as high up as you can get them on your back. Good deal. And that is internal rotation. And then bring your hands back down and put them up behind your head for external rotation. Okay, perfect. Go ahead and put those back down. And you're welcome to turn around and have a seat. Okay, we're going to work our way down the arms, and at this point I'm going to check both brachial pulses here to make sure that they're nice and even. Okay, and they are. I'm going to kind of palpate both elbows, make sure there's no pain. I'm just going to move you around a little bit. Good deal. Again, no crepitus or popping or anything noted. Okay. Now, again, if you put your arms down to your side, and then I want you to flex your arms up like you're doing a bicep curl. Good. And go ahead and bring them back down. And put your hands out in front of you, palms down. That's called pronation. And then I want you to bring them for supination. And then turn them back down, rotate back down. Okay, excellent. And then this time, go ahead and put your arms down again like we're gonna do a bicep curl and pull up against me. And then push back down. Good. Same thing. And push back down. Okay, good deal. We're gonna go ahead and move down, and we're gonna check both radial pulses at this point. They are nice and even and steady. Okay, I'm going to feel both structures in the wrist and in the hands. Any pain at all with that?
No.
Check out all the joints in the fingers. Come over here, same thing. No pain with that?
No.
Okay. If you'll take your wrists, and I want you to flex them down. Okay, and this time hyperflex them up. Good job. Go ahead and do kind of circles for me with those as well. Make sure we've got good range of motion. And then fingers, I want you to make a fist. And then put them back out, and then open and close. Okay. This time I want you to go ahead and try and put your wrist back down against me. Good. And then pull them back up. Okay. And then on your fingers, I want you to try to open against me. And pull back together. And then lastly, on your fingers, I want you at these knuckles here, go ahead and fingers down and then back up. Okay, good. No problems with that. All right, if you would stand for me and then go ahead and lay down back here on our couch. We're going to move down to lower extremities. At this point in time, I want to look at his hips and make sure that they look nice and symmetrical as well, and they do. I'm checking his skin, and that's nice and warm to the touch. There's no rashes. I don't see any bruising. I don't see any edema. There's good hair distribution throughout his legs, nice and equal, and I don't see any varicose veins or anything. While I'm here, I'm going to go ahead and check your pulses. Popliteal pulse. We'll come down here and do the posterior tibial pulse. And check the dorsal pedis pulse. And they're nice and even as well. First thing I'm going to do is check your flexion of your hips. So if you'll keep your knee straight and raise your foot straight up. Good. Okay. And then we'll go ahead and do the next leg. Okay. And then this time I want you to bring this knee up towards your chest. Good. We'll go ahead and do this one. Good. This time bring this knee up and leave it at a 90-degree angle for me. I'm going to hold on to your ankle and hold your leg here, just nice and relaxed. I'm going to kind of move in and out, okay? Any pain or anything with that?
No.
Okay, good. And do that on this side too. No problems?
Yeah.
Okay, go ahead. If you'll bring your feet up and just put those flat, bend your knees. Put your feet flat there. Okay, I want you to push out against my hands. Perfect. Go ahead and pull in. Pull up towards your head. And then go ahead like you're trying to lay your legs down. Okay, good job. No problems with that at all. Okay, I'm going to go ahead at this point and have you stand back up. Okay, we're going to do hip abduction. So I want you to hang on to me and swing one leg out to your side. And bring it back together, and then we'll do this one. Okay, good deal. Then I'm going to have you turn around, all the way around, and then leg straight out behind you. Good, and we'll do the next one. Okay, good job. I'm going to grab this, and we're going to have you sit so I can look at your knees. Same thing as before, I want to assess the structures, I want to feel, make sure everything looks like it's in alignment, no pain or anything, there's no swelling or fluid accumulation, you don't feel anything there. Go ahead, I'm going to move your foot around a little bit, not noticing any like crepitus or anything like that, good. Okay, I want to do knee flexion, so if you pull your feet straight up and out, good, and then back down, okay. This time, go ahead and do it against pressure. And pull. And again, push and pull. Okay, working my way down. We want to check out his ankles and these structures as well. Any pain with that? On your feet, tenderness when I'm feeling around?
No.
Okay, we're going to check your flexion. Go ahead and pull your feet up, and then go ahead and push down for extension. And then if you'll take the soles of your feet and kind of move them out to the side for eversion, and then bring them in for inversion. Okay, go ahead and do some circles with your feet too. Okay, good job. Now I want you to pull up against my hands, pull your toes up, and go ahead and push down. So, any problems or questions with that at all?
No.
Okay. I'm going to go ahead and have you stand up for me. And if you'll turn around so we can take a look at your spine. And we'll start up here at C7, which is the last of the cervical spine vertebrae, and then starts with T1. And we'll work our way down and feel. Any pain or tenderness at all?
No.
Okay. I'm going to turn you to the side for a minute so everybody can see. If you'll notice, the cervical spine here is nice and concave, and then we get convex at the thoracic cage, and then coming down here to the lumbar spine is nice and concave again. So we've got a nice S curve to that. Okay, go ahead and put your back to the camera again, please. Thank you. This time I want you to bend forward so I can assess you're gonna touch your toes, and we have a nice C curve to his spine. At the same time, we're looking at structures to make sure that everything looks even on both sides, and that does. Okay, go ahead and stand up for me. And then kind of hold your hips together or steady, and I want you to lean to one side as far as you can. Good. And then the other side. Okay. And then we're going to hyperextend. I want you to lean back. Okay. Good job. And then again, leave your hips stationary and just rotate your shoulders around like back towards the camera. Good. And then let's do the other side. Okay, perfect. I'm gonna have you come to the couch and turn around and face the camera. I need to assess your gait. So if you'll just take 4 or 5 steps forward and then turn around and come back. And his gait is nice and steady, his balance is good, and the distance between the steps are good. This time I want you to take a couple steps and kind of heel to toe. I'm gonna check some balance here. Okay, good. You can turn and come back. Good job. Excellent. Next thing we need to do is what's called Romberg's test, and we're going to check your balance on this too. So if you can stand with your feet together, put your arms out in front of you, and your eyes open. Okay, and then this time go ahead and close your eyes. Good. Good job. You stayed nice and balanced, so you did good with that. Let me grab your stool again. Have a seat here for me, please. Oh, thank you. We're going to check something called Babinski's sign. So go ahead and dangle your feet, and I'm going to use a butter knife and use the side of it, and I'm going to go down the inside here, starting at the heel around the lateral aspect of the bottom of the foot and across the pad, and see if we can get a good reaction. Good. Next thing we're going to do is a kind of a rapid movement test. I'm going to give you a sequence to do, and I want you to repeat that, and then we're going to speed it up, okay? So I want you to pat your legs twice with the palms of your hand, bring them up, flip your hands over twice, and then back up, and keep doing that, and just repeat that. A little faster. Good deal. As you can see, his movement is even and rhythmic, and so there's no lagging at all. So that's a good sign as well. No cerebellar injuries. Next thing I want you to do is we're going to do the finger to the nose test. I'm going to hold my finger in different locations. You're going to use your pointer finger and touch the tip of my finger, then the tip of your nose, and we'll keep going back and forth for a few movements. One more. Okay, good job. No problems with that then. Okay, I'm going to have you go ahead and lay back down for me for a moment. You're getting your workout today, aren't you?
You bet.
Most exercise I've had in a long time.
Okay. The next thing I want you to do, well, actually, I'm going to have you leave your hands out nice and relaxed, and I'm going to do your hands and your toes. I'm going to move them with your eyes closed, and I want you to tell me if I'm moving your finger up or down and your toe up or down. Okay, so go ahead and elevate your hands a little bit for me. Okay.
Up, down, up, down, up, down, down, up.
Okay. Next thing I want to do is a sensory test. I just dropped all my stuff. I have a Q-tip and I have a toothpick. And as I do this, you're going to close your eyes. And as I touch different points, you need to tell me if it's sharp or if it's soft. Okay? I'm going to do your face and your hands, your legs and your feet. That way there's no surprises. Okay? Here we go. Close your eyes.
Sharp, soft, soft, sharp, sharp, soft, soft, sharp.
Okay, good job. You did well. Okay, and then lastly, we're gonna do your reflexes. So I'm gonna have you sit back up here. Sit on our favorite little bench. I might scoot this back just a little bit, make sure we can see what we're doing. Okay, so I'm gonna grab a little knife here again. We're gonna do the brachioradial reflex first. So I want you to go ahead and turn your hand to the side here, like this. Relax your fingers, okay? And then I'm gonna use this as my hammer, and I'm gonna come up just a little bit, make sure you're nice and relaxed. And same thing here, ready? Okay. I guess I still need this. Okay, this time I want you to keep we're gonna do your patellar reflexes. Keep your leg nice and relaxed, okay? I'm gonna strike you here, ready? It's really good reflex. Good deal. Okay, and then lastly, we're gonna do the Achilles reflex, which is back here. So keep your foot nice and relaxed. Ready? Same thing over here. Okay, good job.
Tickles.
Okay, that was the musculoskeletal and the neurological assessment. And do you have any questions for me?
No.
Okay, thank you so much for letting us film you today.